Are you tired of those sudden, excruciating leg cramps that jolt you awake in the dead of night? Do you struggle with persistent muscle stiffness that makes everyday movements feel like an uphill battle? Imagine a life where your muscles feel stronger, healthier, and completely cramp-free. The good news is, this isn't just a dream. The secret to unlocking this newfound freedom lies in the power of the right foods. These aren't just any foods. They are nature's remedies, capable of relaxing your muscles, boosting your circulation, and stopping those dreaded cramps before they even begin. In this video, we're about to unveil the top 3 superfoods that are specifically designed to help seniors stay cramp-free, maintain robust muscle strength, and enjoy better mobility. So don't even think about clicking away, because you absolutely do not want to miss these life-changing nutrition tips. Before we dive into these incredible revelations, I'd love to know where you're tuning in from today. Drop a comment below and feel free to ask any questions that come to mind as we go along. And while you're there, don't forget to hit that subscribe button and turn on notifications so you never miss another health-boosting tip from Health 365. The powerhouse of protein, eggs. Among the many nutrient-rich foods that champion muscle health, eggs stand out as an undeniable powerhouse of essential vitamins and minerals. But how exactly do these humble eggs contribute to alleviating leg cramps in older adults? Let's embark on an in-depth exploration together. Muscle fatigue is a primary culprit behind cramps, and protein, the building block of life, is absolutely essential for muscle repair and maintenance. As we age, many seniors experience sarcopenia, an age-related muscle loss that significantly increases susceptibility to cramps and overall muscle weakness. This is where eggs shine. They are a complete protein source, meaning they contain all 9 essential amino acids your body needs. A single large egg generously provides 6 grams of high-quality protein, which actively helps rebuild muscle fibers and dramatically reduce muscle fatigue. By enhancing muscle contraction efficiency, eggs can significantly reduce the frequency of cramps. Including eggs regularly in your diet actively supports muscle strength and endurance, thereby lowering the likelihood of those painful, disruptive cramps. But the benefits don't stop at protein. How does the vitamin D found in eggs support crucial calcium absorption and optimal muscle function? Vitamin D is a critical player in both calcium absorption and efficient muscle contraction. Without adequate vitamin D, muscle weakness, cramps, and even chronic pain can develop. Research consistently shows that seniors with a vitamin D deficiency experience more frequent and severe leg cramps. Egg yolks are a natural source of vitamin D, directly supporting bone and muscle health. While sunlight exposure is the most effective way to produce vitamin D, many older adults spend less time outdoors, making dietary sources incredibly crucial. Eating eggs can help seniors maintain optimal vitamin D levels, thereby significantly reducing their cramp risk. So, can eating eggs regularly truly help prevent vitamin D deficiency-related muscle cramps? Yes, it can certainly contribute, but diet alone may not always be enough. One egg contains approximately 40 IU of vitamin D, while the daily recommended intake for seniors ranges from 800 to 1,000 IU. To maximize vitamin D intake, seniors can strategically pair eggs with fortified dairy products like milk or yogurt, or with fatty fish such as salmon and sardines. If your vitamin D levels are particularly low, considering a supplement might be advisable, and of course, spending time outdoors for natural vitamin D synthesis remains invaluable. While eggs are a valuable contributor to vitamin D intake, combining them with other sources ensures better overall muscle and bone health, leading to a noticeable reduction in cramp episodes. Beyond protein and vitamin D, vitamin B12 plays a direct and vital role in nerve function. When B12 levels are low, nerve signals become impaired, leading to frustrating muscle spasms, tingling sensations, and, you guessed it, cramping. Eggs help protect nerve health by providing both B12 and choline, which work synergistically to support nerve insulation, the myelin sheath protection. This dynamic duo improves communication between muscles and nerves, ensuring smooth contraction and relaxation, and actively helps prevent neuropathy-related cramps, which are particularly common in diabetics and seniors. Eating eggs regularly supports nerve integrity, helping to reduce those misfired signals that so often lead to muscle cramps. Are older adults more prone to muscle cramps if they have low B12 levels, and how can eggs help? Absolutely. Seniors are more vulnerable to B12 deficiency due to several factors. Reduced stomach acid production, which limits B12 absorption. Common medications like metformin or acid reflux drugs that can deplete B12 levels. And a lower intake of animal-based foods due to various dietary restrictions. B12 deficiency can manifest as frequent muscle cramps and weakness, nerve damage leading to burning, numb, or tingling sensations, and even anemia, which reduces oxygen supply to muscles. Eggs are a senior-friendly source of B12, easily digestible, and a simple yet effective way to help prevent these cramp-inducing deficiencies. While meat, fish, and dairy are excellent B12 sources, eggs offer a lower-fat alternative to red meat, better digestibility for seniors with weaker digestive systems, and a rich combination of protein and various vitamins, not just B12. For vegetarians who consume dairy but avoid meat, eggs are one of the best ways to maintain healthy B12 levels. So, how many eggs per week should seniors consume to support muscle health without increasing cholesterol concerns? Modern research now confirms that moderate egg consumption, around 6 to 7 eggs per week, is safe for most healthy individuals and does not significantly impact cholesterol levels in healthy seniors. For those with pre-existing heart conditions or high cholesterol, consulting a doctor is always advised, but replacing processed meats with eggs can still be a heart-healthy choice. Can eggs specifically help reduce nocturnal leg cramps in seniors? Yes, nocturnal leg cramps are frequently linked to poor muscle recovery, electrolyte imbalances, and nerve dysfunction. Since eggs provide protein for muscle repair, B12 for nerve protection, and vitamin D and calcium for muscle function, including eggs in an evening meal or even at breakfast, can help balance essential nutrients and support overnight muscle recovery, thereby significantly reducing those disruptive nighttime cramps. It's important to note that certain seniors may need to adjust their egg intake based on specific health conditions. For instance, seniors with kidney disease may need to limit protein intake and should always consult a doctor. Those with high cholesterol can opt for egg whites instead of whole eggs, and diabetics should pair eggs with fiber-rich foods like vegetables and whole grains for better blood sugar control. However, for most older adults, eggs are a highly beneficial food that supports muscle, nerve, and overall health. To maximize these benefits, seniors should aim to eat eggs regularly, 6 to 7 per week. Pair them with other nutrient-dense foods like leafy greens, dairy, and nuts, and always stay well hydrated while maintaining a balanced electrolyte intake. For seniors looking to naturally reduce muscle cramps, eggs are a simple, effective, and delicious dietary addition. So, next time you're preparing breakfast, consider adding an egg to your plate. It's truly one of the best choices you can make for your muscle health. The tropical treat bananas. Potassium, an unsung hero, is an essential mineral for proper muscle contractions, efficient nerve signaling, and maintaining fluid balance within the body. When potassium levels drop too low, a condition known as hypokalemia, muscles become far more prone to frustrating spasms and painful cramps. This is where the humble banana steps in as a true champion. Bananas are one of nature's best natural sources of potassium. A single medium banana contains approximately 420 mg, which accounts for a significant 12% of the recommended daily intake. By helping to maintain proper potassium levels, bananas play a crucial role in regulating muscle contractions and preventing spasms, ensuring smooth nerve communication for optimal muscle control and balancing fluid levels, which in turn reduces dehydration-related cramps. For seniors, incorporating 1 to 2 bananas into their daily diet can significantly help reduce the frequency and intensity of muscle cramps. So, what exactly happens when potassium levels are too low, and how does this directly contribute to muscle cramps? Potassium is vital for transmitting electrical signals between nerves and muscles. When its levels decline, muscles become overly excitable, leading to frequent and involuntary cramping. Nerve signals become disrupted, further increasing the risk of these unwelcome muscle contractions. Furthermore, cells lose their ability to effectively balance fluids, resulting in muscle stiffness and discomfort. Studies consistently show that seniors are at a higher risk for potassium deficiency due to various factors, including reduced appetite or poor dietary intake, side effects from certain medications, such as diuretics for blood pressure, and excessive sweating or dehydration. By simply including bananas in their diet, seniors can naturally replenish their potassium levels and support normal, healthy muscle function.